everybody for joining us today on our webinar, Preparing Your State for Federal SNAP Changes. As was mentioned before, I'm Jennifer Butler with the Center for Practical Federalism, and on behalf of our team, I wanted to welcome you and thank you all for joining us on what I'm sure is a very busy week. For those of you that are new to us, I'm with the Center for Practical Federalism, and it is part of State Policy Network. And the center's mission is very straightforward, very simple, right? We want to help state and local leaders understand how federal decisions impact the things that they're working on, the priorities that they have, and equip them with the tools, the data, and partnerships to respond effectively. We deeply believe in the principle that the best solutions come from the ground up, not from the top down. And for the topic that we are discussing today, this principle couldn't be even more relevant. As most of you all know, the One Big Beautiful Bill passed earlier this year, and it's fundamentally reshaped that federal-state partnership for SNAP. For decades, the federal government covered 100% of SNAP benefits, with the states only sharing about 50% of the administrative cost. That structure is changing. Beginning in FY 2028, states with payment error rates 6% or over will be required to share in benefit costs, ranging from 5 to 15%, depending on their accuracy rate. And that might sound like a small percent, but for those state leaders on this call, you know that it means real dollars, hundreds of millions of dollars, potentially in new cost. And because the calculations are based on your FY 2025 or FY 2026 error rates, the clock is ticking now. So this discussion is about what states can do now, right before those rates are locked in, to strengthen oversight, to modernize verification systems, and to avoid major fiscal exposure later. And more importantly, protect this program to serve those that truly need it while remaining sustainable for future generations. We are fortunate to have two outstanding experts that are going to share their perspective and recommendations on how states can prepare and respond to these changes. We have Leslie Ford with the Alliance for Opportunity and Hayden Dubois from the Foundation for Government Accountability. Both have been deeply involved in helping and advising, putting the bill together and the policy changes together, researching these changes and advising states on best practices. They're going to walk through their findings and highlight practical steps states leaders can take now to strengthen oversight, improve accuracy, and just safeguard state budgets. And then following their presentation, we'll hear from Daniel Erspamer, CEO of the Pelican Institute for Public Policy in Louisiana, who just will offer some closing reflection, a call to action. And then to close us out and land the plane, you'll hear from Madison Ray from the Center for Practical Federalism, just to explain how you can connect with us and the experts to help you continue this discussion and make some significant policy changes in your state. So enough from hearing from me. Let's get on to the main show, and I'm going to hand it on over to Leslie Ford. Thanks so much.
Thank you so much, Jen. So I'm going to really zero in on the SNAP error rate and a few more changes that are happening now, so that the state leaders that you're talking to, this is probably what they're panicking about right now, and rightly so. But they don't need to panic. There are positive steps they can take to address this. Before I get started, I just want to talk a little bit about the Alliance for Opportunity. This is a project of state think tanks. You'll see Daniel speaking to you at the end. It was kind of his brainchild of state think tanks coming together to ensure that their states are focused on moving low-income individuals into self-sufficiency over the long term. And so you can see the think tanks that are part of this project on the screen in front of you. Okay, so what did the One Big Beautiful Bill Act do in SNAP? It did a couple of things, but the real big three that I want to zero in on today is the new state match. So this is going to be based on states' error rates. If they have under a 6% error rate, which is kind of the average over the last 20 years-ish, it's going to be a 0% match. The federal government is still going to be covering 100% of benefits. Now, if they're at 6% or all the way up until 8%, it's a 5% match. Between 8 and 10%, it's a 10% match. And for those states that have over 10% of their payments being sent in error, it's a 15% match. Now, how do we calculate errors? Before the One Big Beautiful Bill was passed, it was any error over $56 as of 2024. Now it's going to be any error over $0. So if a state makes a deduction error, as in they ask the applying household, what are your childcare costs? And they get that wrong. And they don't count it correctly. A deduction cost can be, it can affect a couple dollars here and there, up to $10, $50 of a monthly benefit. That will now count as an error. That's important. It is an error. We are sending that an error. If a state is calculating someone's deductions or eligibility incorrectly, that's an error. We're catching all of that now. And the third important piece for states to monitor is that their administrative match. How much they pay caseworkers, all of those eligibility systems. That's what we're talking about when we're talking about the administrative match. It used to be covered 50% by the feds. Now just 25% of that cost will be covered by the feds. So those are three really big errors. And I think it's important to focus on the why before we get to the impact. So we used to have high error rates in 1997, 1998, and those were driven down to 3 to 4% in the between 2009 and 2014. And after COVID, they have skyrocketed. Immediately coming out of COVID, we saw nearly 12% error rates. Right now, they're about 10.93%. Now, these are underpayments and overpayments, but about $1 in $9 is going to someone who does not qualify for the benefit. That's a lot of money when you're talking about $100 billion a year program. So that is why these changes were made in the One Big Beautiful Bill. Because the error rates are out of control, the states are the ones implementing. The states have not had skin in the game in ensuring that they drive down their error rates. So the feds created skin in the game. Skin in the game exists in other programs. For instance, Medicaid generally has about a 70% on average match for the traditional population. They're carrying that state responsibility, that essential aspect of federalism, which is that states have skin in the game, into the SNAP program for the very first time. Okay, next slide has a lot of numbers, but I'm going to focus on the one that's in the big one. If nothing changes, states are on the hook for $11 billion in 2 years. That's a lot of money. It ranges, there are 8 states that have been doing great. They have error rates under 6%. They're going to be paying nothing. Most states don't, obviously. So some states like California, they're looking at $1.8 billion. That's a lot. Other states, even I'm going to pick on Virginia because that's where I am. Virginia is on the hook for about $258 million a year. I don't know about most state budgets. I don't know about every state budget, but for most states' budgets, that's a lot of money. Okay, so what can states do? What proactive changes can states start? Because while the state match goes into place in FY 2028, it's based on the state's FY 25 or 26 error rate. Hopefully, the 26 error rate is lower than the 25 error rate. And that means you have maybe just this legislative session, maybe just changes that you can implement over the next 6 months to really drive down that error rate. I'm going to focus on 4 reforms today that you might want to bring to your state legislators, that you might want to bring to your state SNAP administrators and say, are we doing this? So first is to cross-check the applicant's information. Now you might think like, oh, the applicant is putting on their form, they make $0. We're going to run their name and we're going to check that. Not all the time. States currently get pinged, they get fined if they don't get out the SNAP benefit within 30 days. And there's something called right to file in place where if the application has a name, address, and a signature, the state has to process it as though it's a real application. But the states, if they're implementing even in-state wage data checks, and they're saying, okay, John Smith says he has $0, is that true? If they are cross-checking the deduction info, they will catch a lot of these errors with just simple in-state cross-checking solutions. Most states have in-state wage data. They're just housed in a different department. That doesn't have to be the case. You can make sure, pass legislatively, or if you have a governor on your side, you can cross-check that really easy. Second, reduce recertification periods. Most states are only checking whether someone is eligible every 12 months. But in this population, there's a lot of churn. A lot of people return to work, their incomes change throughout the year. The error rate will catch that. If you are not checking more frequently, say every 6 months for a non-disabled, non-elderly household, you're not going to catch that, and the QC will. Third is ending simplified reporting. This again gets into, are you checking throughout the year, even cross-checking against those in-state data sources, whether the individual, whether their income changes, whether their deductions changes. Most states have opted into simplified reporting since about 2005. That was supposed implemented to drive down error rates. It has not. It has error rates have risen drastically. So you can opt out of simplified reporting. You can put a requirement on the beneficiary that if anything in their income or deduction changes, they have to report it to their local Department of Human Services within 10 days. Those are easy ways to put in common sense solutions. You can also opt out of broad-based categorical eligibility. I know Hayden is going to go into that into more depth, so I'm going to rush by it. But these are common sense solutions that you can put in place in the next 6 months to really drive down your error rate so that you're not seeing hundreds of millions of dollars go out of state budgets for errors that really shouldn't be in place in the first place. One more thing I really want to hit as we're looking at the implementing the one big beautiful bill overall. As you see in front of you, this is Louisiana safety net. Daniel is going to probably address this later on. But the one big beautiful bill makes a variety of changes across almost all the big safety net programs. So it's not just SNAP, it's also Medicaid, it's also taxes, it's also workforce with the new Pell grants. And these changes honestly hit usually the same type of family. So it's the same low income family who's applying for all these programs. And when you're seeking out vendor solutions, when you're seeking out reform solutions, I encourage you not to do it a program at a time. If you're doing cross-checking, it should be for Medicaid and SNAP and workforce. If you're doing ending simplified reporting or lining up redetermination checks, do it across program. There are some provisions in OBA that will require you to do this anyway. For instance, in the Medicaid piece, you're going to have to track out-of-state addresses for the first time. So when you're talking to your state your state legislators, when you're talking to administrators, think of the safety net every single program. Don't try to don't try to apply solutions to just one program at a time. All right, that is everything from me. I'm going to turn it over to the Foundation for Government Accountability's Hayden.
Les, really appreciate that introduction. I'm going to pick up sort of right near where Les left off and talk about broad-based categorical eligibility in a little bit more detail. And Les touched on why this is important for states when considering state cost share. I'm going to dive into that in a little bit more detail and also talk a little bit about an interaction between the expanded food stamp work requirements and the state cost share, because there is some relation there as well. But let's first talk about broad-based categorical eligibility, or BBCE. Under federal law today, food stamp enrollees have an income limit and they have an asset limit. The income limit is that gross income cannot be above 130% of the federal poverty level, and net income, which is just after some deductions, can't be above 100%, which is between $15,000 and $16,000 for a single adult. The asset limit for most households is $3,000 in countable assets, but it's $4,500 if you have someone who's elderly or disabled in the household. When we're talking about assets, though, we're excluding a whole bunch of things that you would normally categorize as an asset. So a primary residence, a retirement account or pension, a life insurance policy, a primary vehicle, in some states more than one vehicle, and personal possessions are all exempt. What we're really talking about is liquid assets like cash in the bank and stocks. We don't want individuals accumulating tens of thousands of dollars in their savings account for a program that's designed for the truly needy. But in the late 20th century, a concept of categorical eligibility was introduced. The theory was if you're already eligible for cash welfare, the TANF program, you don't need to be independently verified for the food stamp program. The Clinton administration, and later supercharged by the Obama administration, created broad-based categorical eligibility and essentially expanded the definition of what a TANF benefit was while also permitting states to raise their income limits and get rid of their asset limits entirely. So now there's a whole set of what we would call non-cash TANF benefits that can make someone categorically eligible for food stamps, even if they exceed asset and income limits federally. Something as simple as receiving a welfare brochure or getting a referral to a toll-free welfare hotline, even just being eligible to receive one of those non-cash TANF benefits can bestow upon someone broad-based categorical eligibility. So the way it works is states get TANF block grant money. They can use that money to print out these brochures, set up these toll-free phone lines, and then they can deliver those non-cash benefits to households, making them categorically eligible for the food stamp program. Now, the results of that are pretty dramatic. For a while, we saw food stamp enrollment creep up, relatively stable. After the reforms in the mid-90s, it creeped down again, which was good. And then right at the turn of the century was when BBCE took effect. And you can just see the explosion in food stamp enrollment that occurred in the following years, even before the sort of peak of the Great Recession, as more and more states adopted BBCE. Today, 40 states have BBCE in some form or fashion, meaning they either allow a higher income limit or they do not have any limit whatsoever on assets or have a higher limit than the federal standard of $3,000. The result of this, unfortunately, is that nationwide today, there are 5.4 million Americans on the food stamp program through BBCE that don't meet eligibility requirements federally, which is costing taxpayers about $112 billion over the next decade. This has clear implications for OB3 because BBCE swells food stamp enrollment. It makes the food stamp rolls larger and more populated than they otherwise would be, which means states that are on the hook for a cost share because of their error rate will be paying more than they would be in the absence of BBCE. So the solution without federal action is to roll back BBC at the state level. It can be done. Mississippi actually did it a handful of years ago, and they survived. They got it done. Their food stamp program is much more manageable than it was pre-BBCE. So it's something states have the power to do and should really consider in light of the state cost share to minimize their cost exposure and preserve the program for the truly needy. Now, one last thing I wanted to focus on briefly is the work requirements and the way that actually connects to the cost share. So just some quick background. Prior to the One Big Beautiful Bill, most food stamp work requirements applied to ABODs, able-bodied adults without dependents, aged 18 to 54. But because of waivers and exemptions, most of these ABODs didn't work. 74% didn't work at all. Only 23% worked full-time and only 23% worked part-time and only 3% worked full-time. OB3 changed this pretty substantially. It raised the upper age limit of the work requirement from 54 to 64. It applies it to parents of kids aged 14 plus, in addition to childless adults. It also eliminated categorical exemptions that were created in 2023 for veterans, individuals who are homeless, and young adults who recently aged out of foster care. It created a new categorical exemption for Native Americans, and it narrowed geographic waivers that could previously be used and can still be used in some fashion to waive certain areas of a state based on their unemployment rate. The policy recommendations are pretty straightforward. First, don't use geographic waivers. Don't set up this sort of patchwork of one county has a work requirement, the next county doesn't. So depending on where you live, you may or may not be exempt. It's a bad way to conduct public policy, and it results in many able-bodied adults being exempt from the work requirement just because they live over an arbitrary county line. Similarly, don't use discretionary or no good cause exemptions. These are allowances that states receive on an annual basis to exempt individuals from the work requirement, just as it says, for no good cause. It's at the arbitrary discretion of state human services agencies to make those determinations, and it can cause the work requirement to be less effective. And lastly, verify all exemptions, legitimate exemptions from the work requirement. So if someone's claiming they're medically unfit for employment, make sure they demonstrate that through a note from a physician or provider of some sort saying that they're physically or mentally unable to perform work, not just that they're self-attesting that they're medically frail or some other exemption criteria. And the point I would really drive at here is the connection between work requirements and the cost share. The more successful, the more robust work requirements are, the smaller the state cost share for those states whose error rates has put them on the hook for a state component, because work requirements can have an effect towards shepherding able-bodied adults from welfare to work and depressing the overall size of the food stamp rolls and refocusing it on the truly needy, like children and adults with disabilities who are elderly. So if states want to reduce their cost share liability, one of the best ways to do that is through a robust implementation of the work requirements without waivers and exemptions. I'm going to pass it over to Daniel.
All right. Thanks, guys. And Hayden, I just want to give a special thank you to you for making me feel a million years old by referring to the late 20th century and turn of the century. That's really great. Great overviews, Les and Hayden both. Appreciate all that data. I just want to sort of zoom out maybe a little bit and think about what we're all trying to accomplish here, what I would suggest we're all trying to accomplish here. The objective with a safety net, although it's rarely met in the current iteration of it, is to help people temporarily so that they can get back on their feet and get back to work, and work as really the solution, the core solution to poverty. And I just want to sort of zoom out and encourage everyone not to miss the forest for the trees. So you've heard a lot already about fixing the error rates, and that is unbelievably important. And for the legislators or policy leaders here, what we suspect we'll hear is the agencies coming to ask for money and resources and time to upgrade data systems and really prepare for what passed in the One Big Beautiful Bill related to these error rates. And that's good. That's absolutely critical, absolutely important. I would just add an and, which is this is an opportunity to see a bigger picture. While we're doing it, don't think about these safety net programs as program specific, but we really encourage you to think about this as person centric. We want these programs to work together as best as possible to speed the process of moving someone from dependency to self-sufficiency. The good news, you saw the map that Les put up about the social safety net, such as it is in Louisiana, dozens of disconnected programs. The good news is the legislature took action and the governor took action to begin the process to integrate those programs in a holistic case management system we call One Door. And that's, many of you may know, has been a major initiative of the Alliance for Opportunity. And so Louisiana likely has a little bit of a head start on the rest of the country in addressing this. Would encourage everyone, whether you're going all in on a one-door effort or a longer burn on this, look at the opportunity to see data upgrades, eligibility checks as an opportunity to consolidate some of those data systems together and do this as a whole safety net rather than just focus on one program, in this case, SNAP. As Hayden mentioned, and Les as well, this also, the changes in One Big Beautiful Bill range from SNAP to Medicaid and other programs in between. This is a chance to really rethink how the state administers those programs and how, again, we can make these centered on the person rather than the program and more quickly smooth those pathways from dependency into work. So would encourage you, if you're interested in learning more about One Door or any of those solutions, please reach out. I know we've leaders on the call here. Other states are working on this, from Arkansas, Mississippi, West Virginia, maybe some others as well. Texas and Georgia, I know, have also looked at task forces. We're happy to be as helpful as we can, but would just encourage you, this is going to be a big push. It's going to be hair on fire for most of our friends in the agencies and in the legislature. I think it's a chance for us to zoom out and help make the bigger case about reform and do that, tackle all of this as we're doing the one. So I really appreciate the chance to share some final thoughts on this. We are seeing some success in Louisiana. The lead of Louisiana Works, Susie Showen, as well as Bruce Greenstein at the Department of Health, and lots of folks in between have really been doing great work to try to prepare Louisiana to transform this system into something that really moves people into work and opportunity.
Daniel, Les, Hayden, thank you so much for the time. Really appreciate it. I am going to go and hand over the control to Madison. She is Senior Director of the Center for Practical Federalism, a great colleague of mine, just to wrap us up and send us on our way. Thanks, Madison.
Perfect. Well, thank you, Jennifer. And again, just a big thank you to Les, Hayden, and Daniel. We really appreciate your expertise and your time on the call today. There is no doubt that state leaders are navigating new waters with the changes to the SNAP program, but these changes present an opportunity for states to ensure that these programs are truly helping those who need them most. The experts on this call, I know we just shared this, but also too, we at the Center for Practical Federalism can work with you, and we are very happy to work with you to strengthen program integrity, to help you implement best practices to decrease error rates, and provide state oversight strategies to help you improve your systems and fix these problems before they become costly. Again, our experts are happy to connect with you. We at the center, happy to chat with you as well. We can be reached. You can reach out to me and I'll get you to the right person. I can be reached at ray@spn.org. Again, thank you for your work in the States, and thank you to all of you for joining us today. That's all we have.